Hi there, Medicare by AMA agents. Welcome to the Medicare Academy here. This is one of our new trainings here, and welcome to our training for the next 45 minutes. We're going to be talking about DSNP or dual special needs plans and really how to be successful in this market. So there's been a lot of talk about dual eligibles, the changes that have happened in all states with Medicaid and obviously with Medi-Cal in California as well. So we're going to really talk through how to be successful in this market and share some ideas and hints and tips, as well as hopefully give you a little bit of education on how some of these plans work. So we'll get started without further ado. So our agenda today, we're going to first talk about programs for low income folks with Medicare. We're going to then, part of that, talk about the Medicare Savings Program. This is sometimes where people get confused with Medicaid, and we're going to talk through the differences and the different types of programs and what they pay for. We're then going to go into Medicaid and Medi-Cal and some of the differences and the different types of plan options within the Medicaid and Medi-Cal scenario. We are then going to go on to plan choices for those that have both Medicaid and Medicare, or as we know them, dual eligibles. And we're going to talk about enrollment periods as well. We're then going to talk through some of the updates that are coming both for 2024 and some that have happened during this last year. And then finally, we're going to talk about really getting out there and how to market yourself to dual eligible folks and really immerse yourself into that marketplace. So without further ado, let's get started. So there are a number of programs for low-income seniors that have Medicare, and we're going to talk about some of those programs now. So as you know, we have, first of all, the state Medicaid or Medi-Cal. As you know, this is a joint funded state and federal healthcare program. And this is for those folks that have low income and resources. Generally speaking, it covers hospital, medical, and also long-term care services as well. So that's an important differentiator with Medicaid and Medi-Cal, particularly if you're comparing it to the Medicare Savings Program. That brings me nicely on to the Medicare Savings Program. This is a federally funded program, and this program in particular helps pay for those Part A and or Part B premiums, deductibles, co-insurance and co-payments. And these are administered by each state individually. So it's a federal program administered by each state. We then have the Low Income Subsidy, or LIS, also known as Extra Help with Part D. This is a federal assistance program again. It helps Medicare beneficiaries pay for their Part D for drugs, monthly premium, annual deductibles, as well as that co-insurance and co-payments. And this is managed by both CMS and also Social Security Administration. And quite often the LIS or Low Income Subsidy Program can work hand in hand with the Medicare Savings Program and also the state Medicaid or Medi-Cal. So essentially, if you're applying for that Medicare Savings Program, you can actually then apply for the low income subsidy as well, or vice versa. So let's first of all start off by talking about the Medicare Savings Programs. We're going to talk through those limits for 2023. So qualified beneficiary or Medicare beneficiary is known as QMB. So the QMB program helps pay for Part A premiums, Part B premiums, all of those deductibles, co-insurance and co-payments. So generally speaking, this is with the folks that has the lower monthly income limit. And these are the income limits for 2023. For an individual, it's $1,235 per month. For a married couple, it's $1,663. And then the resource limits is $9,090 or $13,630. So that's for QMB. Specified Low Income Medicare Beneficiary or SLIM-B program. This helps pay for Medicare Part B premiums. You must have both Part A and Part B to qualify. And the income and resource limits for this program is $1,478 for an individual or a married couple at $1,992. And if you look at the resource limits, they're exactly the same for QMB as they are for SLIM-B. QI is another one, which is qualified individual. And again, this helps pay for Part B premiums. You must have Part A and Part B to qualify again. And this goes slightly up. So it's $1,660 for an individual, and a married couple is $2,239. Then you have what is known as the Qualified Disabled and Working Individual, QDWI program. You may qualify for this program if you have a disability and are still working. So this is slightly different. And again, if you've lost your Social Security disability benefits and Medicare premium free Part A because you return to work, this may help you. And again, these limits are pretty high, as you can see. It's $4,945 and $6,659 for a married couple. But don't forget, this is in particular for those folks that have a disability and are still working, but maybe they've lost their Social Security disability benefits. So that is the Medicare Savings Program and the limits. Now we're going to get on to Medi-Cal and Medicaid. As I mentioned before, this is a joint program with federal and state. So each program is slightly different with each state, and it's based on the income and assets. It does vary by state, and you must be a resident in the state which you apply. And please note, if you have a client that moves from one state to another, they must reapply to that state for their Medicare or Medicaid, for their Medicaid or Medi-Cal services, depending where they move. And you've seen a lot of folks move from California to Nevada and other states throughout the United States here. So make sure that if you have a client that has moved and they have a Medicaid or Medi-Cal program from the state they've moved, they must reapply. They have to be a US citizen or legal permanent resident. And also there has been some expanded coverage for undocumented seniors over the age of 50 as well. Beginning in May of 22, Medi-Cal in California benefits are going to be provided to all folks that are over 50 and meet financial eligibility requirements, regardless of their immigration status. So this is one example by each state where things change as well. Medicaid, Medi-Cal does help pay for those deductibles and cost sharing for people that have Medicare or Medicare Advantage plans. So a little bit more about the programs. They do vary by state, but below are 3 of the programs available to Medicare beneficiaries in all states. So every state has these 3. Medicare will always pay first for covered services, and Medi-Cal or Medicaid will pay second for those qualifying costs. If they meet income, asset, and other guidelines, they may qualify for the following programs: the Aged, Blind, and Disabled Medicaid, or ABD. This has coverage for a broad range of a lot of those health services. As you can see, hospital, doctors, medical equipment, that type of thing as well. However, ABD Medicaid may not provide adequate coverage if somebody has long-term care needs. The Medicaid Home and Community-Based Service Waiver Program provide general health coverage and also certain services to help you stay at home in a community-based setting. For example, if you're in an assisted living, covered services may include things like homemaker services, case management, adult daycare, that type of thing, as well as skilled nursing and therapy. And to qualify, you've got to meet state-specific functional eligibility criteria. So that will mean you'll need to answer certain questions, or your clients will, to make sure they qualify. There's also institutional Medicaid, and again, this is for folks that are residents in nursing homes or institutional care, and have coverage. This will include that coverage, sorry, for the nursing home services, room and board, nursing care, personal care, and therapy services. So this is where you get into the long-term care services with Medicaid as well. So what does Medi-Cal cover? So Medi-Cal in California here pays for those medically necessary healthcare services, and this is the same in other states under Medicaid as well. So just those basic things like every time you go to the doctor, x-ray labs, hospital, nursing care, home health care, certain prescription drugs excluded as a Part D benefit, prosthetic and orthopedic devices, hearing aids, medical equipment, ambulance services, hospice care, and then some dental services through the Denti-Cal program or the state Medicaid program. Please note, though, that many of these services do have limits. So in particular, the dental services that are offered do have limits in each state. So you'll need to check that out on each state healthcare human services website. Don't forget, Medicaid, Medi-Cal will only cover services and costs if they use providers accepted in that state through Medicaid and Medi-Cal. If somebody has Medicare as well as Medi-Cal, the Medicare is the primary payer, which means Medicare will always pay first for those benefits, and Medicaid and Medi-Cal is secondary. So if somebody does qualify for full Medi-Cal without a share of cost, then Medi-Cal will also cover Part A and B deductibles and co-payments as well. And again, if you have both Medicare and Medicaid, depending how you receive those benefits is going to be obviously dependent on the state that you live in. So there you can kind of see a little bit more about the types of services available for those low income folks that are over 65 or Medicare eligible. So what type of plan choices do they have? A lot of choices nowadays. So you've got that fee-for-service original Medicare in all counties, in all states. Medicare Advantage plans. Don't forget, you do not have to have somebody that has Medicaid and Medicare join a dual special need plan. They can actually join a regular Medicare Advantage plan, and sometimes that may be a good option, particularly if they want to go to a certain doctor. So for example, if somebody lives in LA County, then they may want to go to UCLA or they may want to go to Cedars-Sinai. Well, some of the Medicare Advantage plans actually has coverage with these medical groups. The dual special needs plans may not. So again, you're going to have to find out, like you would with a normal Medicare eligible. Basically, you're going to have to look at their choice of doctors, who they want to see for their services, and that's going to dictate what type of plan you can speak to them about. The dual special needs plans, these are plans specifically for those eligibles that have Medicare and Medicaid. And generally speaking, if you want to have one of your clients join these plans, they will need to have and be either full benefit dual eligible or have QMB or QMB plus. And just to let you know, we mentioned QMB as part of the Medicare Savings Program. QMB plus is just that. It's QMB with the Medicare Savings Program plus Medicaid or Medi-Cal. That's what QMB plus is. It's as simple as that. There's also a program which is called PACE, Program of the All-Inclusive Care of the Elderly. These are plans that can help certain individuals get care outside of a nursing home. So again, this is where somebody can go to an adult day health care center and receive services there. And this will include some of those medical services. They have doctors on site there as well. They also have other services in that location as well. So sometimes, again, they will have things like physical therapy. They may have gym equipment there to use. They may even have things like hairdressing, nail salons, and different things, and other services to help seniors that can get care outside of a nursing home. This is to keep some of those folks that may need additional support, particularly if they're suffering for things like mental health. They can go into these adult day healthcare centers. And again, now these are places that you can actually offer as an agent. So as you know, through WellBe Health, this is one of the newer programs that have been and have come out over the last year or two now, and WellBe Health has a number of these programs, these PACE programs with adult day healthcare centers throughout California. Unfortunately, we don't have this available in Nevada or at the current situation. For Medi-Cal benefits in some counties, you must join a Medicaid or Medi-Cal managed care plan. This is very prevalent in California at the moment. There's a lot of changes going on over the next couple of years with Medi-Cal. And this is where you may need to have your client join a Medi-Cal managed care plan. Also, in other counties, you can still use that fee-for-service Medi-Cal. If you are in a county where you can choose both the fee-for-service Medicare and Medi-Cal, make sure both the doctor or hospital accepts both of those programs. And you do have to present both of those cards as well. Okay. Where the providers are offering services through a managed care program or a Medi-Cal plan, then of course you've got to stay in that network. And now what we have is plan matching services. This is the newest part of this program in California, where what they are looking to do in certain counties, if somebody joins a dual special needs plan that has a Medi-Cal managed care plan, they will automatically get matched on that plan. So for example, if Anthem is the choice for that client for a dual special needs plan, and they are not on an Anthem Medi-Cal managed care plan, and there is one available, they will actually automatically get moved to an Anthem Medi-Cal managed care only plan. So this is something that's happening at the moment in California in many counties, and it's going to be expanded as we go into 2024 and 2025. If somebody does enroll in a Medicare Advantage dual special needs plans, or as we see, the lookalike plans have gone away, but what we're going to say is that there are some C-SNP or D-SNP plans. Don't forget, you must, or your client must see doctors and other providers in that network. Absolutely so true. This is the same as if they joined a regular Medicare Advantage plan as well. And I use the term lookalike here mainly around those C-SNP, D-SNP plans that you are seeing coming out. You're seeing a few of these, as well as Extra Help or LIS plans. So since the lookalike plans went away, you are seeing some alternative type plans that are almost similar to those lookalike type options as well. So we talk about assets. This does change as well in every single state, folks. So please make sure you look at your state eligibility for Medicaid or Medi-Cal. One thing that did change in California was the asset test. It changed in July of last year, and it actually increased to 130,000 for individuals and 195,000 for a couple. These programs included all except for those folks that have the Supplemental Security Income, SSI. These are some of the poorest folks that are in our states as well. Some of the personal assets as well are not considered when determining if you qualify for Medi-Cal or Medicaid. For example, your primary home or your client's primary home, one vehicle, household goods and belongings, life insurance policy with a cash value of up to $1,500 per person, a prepaid burial plan, unlimited if irrevocable, or $1,500 if revocable, which means you can basically change it if it's revocable, and a burial plot. If somebody meets the asset requirements, their income determines the Medi-Cal program which they qualify. And don't forget that asset program was a real changer in California. And again, that's going to go away completely at the start of next year. So there's going to be huge changes here. Don't forget though, with Medicaid and Medi-Cal, and this is where a lot of folks really get a little confused about this program. Yes, it does help pay for those healthcare costs. Yes, it can include long-term care. It can include many other items, But don't forget there's an asset recovery program in place for both Medicaid and Medi-Cal. So of course, this is one of the reasons the assets went up, because that asset test, you know, really is going to allow those states to go after those assets and recover those assets. So if somebody is utilizing Medicaid or Medi-Cal to pay for long-term care, when that person passes, and again, their assets are still there, they are going to be subject to that asset recovery program. So this is something important to let people know. And I know there's folks out there that don't particularly want to have their assets really disappear. They don't want to have that asset, you know, go for, you know, they don't want to have that program where they're going to lose some of their assets. So this is really important. Now we're going to talk about those income levels to qualify for Medi-Cal. So we want to make sure, again, those different requirements and programs here, and we're just going to bear with us because I think we have an issue here with our let's make sure you can see my screen correctly. Okay, there we go. So supplemental Social Security income, as I mentioned, this is for those folks that are have up to $1,040.21. A couple is $1,765. The aged and disabled poverty level is 1,583, and a couple is 2,126. Medi-Cal with the share of cost, and of course this is Medi-Cal in California. You're going to need to check this out for your specific state. Is 1,583, and a couple is again is 2,126 over that limit, of course. And again, the working disabled is, as I mentioned, up to 2,852, and a couple 3,835. So these are the program requirements there. And if you look back at the opportunity, because we know that the changes that have come afoot recently and some of the things that we've been talking a lot about over the last year or so is the opportunity. 12.5 million people had DSNPs in 2020. These benefits include that next level service. And dual special needs plans that came into effect in California once the program, the dual demonstration program left, that really showed folks that were of lower income that had both Medicaid and Medicare, or Medi-Cal and Medicare, they now have the opportunity to have all of these additional benefits that have come into place. You've got the healthy food cards, you've got those wellness benefits, meals, acupuncture, adult day healthcare, health products, so that over the counter. You've even got now the carriers that are offering that flex card where you can actually spend that money on what you need to spend. Even gas is coming out, gas cards, and being able to spend it on rent or utilities. So there's a lot of options. Dental coverage is huge in the Medicaid and Medi-Cal dual special needs options. So please, you know, look at what options are available, find out where these clients need your help and where they're most needed. And again, things like food cards have become so popular because they earn those valuable extras that some of these folks cannot afford. And the ease of using it with a just one-time swipe card. So for example, many of our carriers have the Flex card, or they have the U card, or whatever they want to call that card. It's the same thing. That card has a MasterCard sign or a Visa sign, and they can use that at various retailers, Walmart, CVS, all of these Kroger stores, all of these places, they can buy healthy food and plus over-the-counter goods in one go. It can also be used to pay your utility bills or your rent, and in some cases, even at the gas station. These are those additional benefits that are not covered under Medicaid or Medi-Cal. These are the things that we should be talking to these folks about. And the fact that with Medi-Cal in many counties, the requirement is to go on a Medi-Cal managed care plan. Well, this is pretty much similar to a dual special needs plan. So obviously, when you're talking to these folks, they don't understand how things have changed. They just think they get all of the services available, and they think sometimes it's too good to be true. Well, the reality is, because with the dual special needs plans, the Medicare plan, the Medicare carrier is the one that's going to be administering and managing that plan. They can offer all these additional benefits, and that's so important for your clients. Of course, prospects and eligibility for some of these prospects. This is a great table because this tells you how and where all of your clients can get their Part A and Part B paid for. Quite often you'll see somebody that doesn't have Part A, and I know from just experience, these folks have been told they don't qualify for Part A. Well, eligibility for Part A and B is exactly the same. So if somebody qualifies for Part B, then they must qualify for Part A. What they are not being told is you may not qualify for free Part A or for Part A at no cost. So eligibility is exactly the same. However, depending on the program you have, depending whether you qualify for Medicaid or you qualify for the Medicare Savings Program, this will show you what program you get. Extra help with Part D you get with all of these programs, and of course there are different levels of that extra help with Part D. A lot of the Medi-Cal, Medicaid dual special needs plans that are available do actually now have those drug costs at zero, no matter the extra help program. But again, if they qualify for that dual special needs plan, many of these plans now have those drugs at zero cost right through the gap, no matter what tier. That's a real enhancement we've seen over the last year or so. Now, if you just look at what pays for and what doesn't pay for some of these Part A and Part B premiums. As you can see, full benefit dual eligible. Again, Part B will generally be paid for by the state at that stage through the Medicaid or Medi-Cal, but it does vary by state. QMB and QMB Plus will always pay for both Part A and Part B. So if somebody has QMB through the Medicare Savings Program Plus, Medicaid or Medi-Cal, or they just have QMB, it will always be paid for both Part A and Part B. Slim B always pays for Part B. So if somebody qualifies for Slim B, they will always get Part B paid for, that premium. They won't get the Part A paid for though. So again, they will qualify for free Part A. If somebody has Slim B only or Slim B Plus, and again, Medicaid or Medi-Cal, that's exactly the same. They get that Part B paid for. If they qualify for QI, qualified individual, they will also get Part B paid for. The only one that doesn't get Part B paid for, the premium, is QDWI, which again is on that qualified disabled working individual, but they do get Part A paid for. So again, as you can see, the income level on somebody that's disabled, that's working, that qualifies for this, they will get Part A paid for, but not their Part B as well. So just make sure you realize that majority of cases, the Medicare Savings Program is the thing that pays for Part B, as you can see, through QMB only, Slim B only, and QI only. If somebody has both Medicaid and the Medicare Savings Program, that's where the plus comes in. So the QMB Plus, Slim B Plus, and of course that will pay for Part B, and quite often it will also pay for that Part A as well. Again, the Medicare deductibles and copays varies by state on some of the programs that is full benefit dual eligible, but generally they will. absolutely. And of course, that full Medicaid status is for full benefit dual eligible or QMB plus and Slim B plus as well. And those Medicare deductibles are also paid for in full with the QMB program through the Medicare Savings Program. So please take a photo of this. You can look at this if you need to understand how this program works. This is that mix of Medicare Savings Program and, of course, Medicaid and Medi-Cal. Enrollment periods, pretty straightforward. I think you guys know this now. Don't forget, for the first 9 months of the year, they can make one switch. Yep, one switch, whether they are fully dual eligible or if they have LIS, it's the same rules apply. So January to March, you can make one switch from one Medicare Advantage plan to another, including dual special needs plans, one in Q2 and one in Q3. Please note, once you hit October 1st, you must follow the AEP or eligible election periods. So in Q4, you cannot make a change after September 30th until October 15th, and then that will not go into effect till January. So don't forget, you are running by the same rules as all the folks using AEP or the annual election enrollment periods for Q4, okay? The other suggested SEPs that somebody that is dual eligible could use if they want to go into a 5-star plan, they can use this once a year, anytime during that year after December 1st. You've got the dual LIS, loss, gain, or change. So of course, some of our folks are going through the redetermination. This was always in, but it's stopped through COVID. It's come back out. This is why some of those folks are losing, the gaining, or the changing their status. They do get an SEP. If they have a change in prescription drug plan and they're auto assigned, then they do have an SEP as well. And again, a Medicare, Medicaid plan, if they have a passive enrollment or the state has assigned them, then they will get an SEP as well. And of course, we've got many of these weather-related emergencies as well. Each carrier does provide an election period resource book. Please look it up. I always say United Healthcare has a fantastic resource that you can use as well. Some of the updates, we've gone through some of these. The big one at the bottom here, from January 2025, Medi-Cal managed care plans in non-CCI counties will be required to operate Medicare D-SNP. So there are still some counties that do not have dual special needs plans. They will be coming into effect in 2025. One, for example, is Santa Barbara County again. And this is where the care coordination program was, don't forget as well. Managed care plans operating in the care coordination programs is or are required to operate dual special needs plans, transmitting in that transition from the Cal MediConnect program that California had for many, many years as well. Also, January of this year, there was a full transition of mandatory enrollment as well of dual eligibles into the Medi-Cal managed care to all dual and non-dual fee-for-service beneficiaries as well that were residing in a long-term care facility. So don't forget, they will be all enrolled into a managed care Medi-Cal plan, not Medicare plan, Medi-Cal plan as of January. And of course, in some counties, that program is continuing with the Medi-Cal managed care program. And of course, we talked about where you have that matching program in certain counties as well. Again, in many other states with Medicaid, this program continues to be enhanced, and the asset tests and things like that are still changing. So please make sure, depending where you live, you are looking at the state website, and again, including utilizing Social Security Administration, CMS, and the Department of Healthcare Services as well. So please make sure you utilize those as resources. Links are on our agent portal for some of those as well. Now we're going to talk about the opportunity to market yourself, what you can and can't do. So really, these are some of the things that you should be looking at if you want to really immerse yourself into the dual special needs market and this population. Being a resource. Again, selling isn't the word to use here. It's really helping our seniors understand how Medi-Cal, Medicaid, and Medicare works and how they work together. So you've got to be that local resource. And of course, you can reach out to any of these type of places. Some of you already have relationships with doctor's office, gyms, pharmacies, senior centers, mobile home parks. These are just some of the places that you will find folks that do have that limited resources or lower income. Of course, as well, food banks are a great place to really go and offer your help. And I know a number of agents that actually are in these places week in, week out, and volunteering as well. So giving back to the community, working with some of these community-based organizations, or CBOs as they're known as well. So maybe attend some community events, maybe offer your services, do some educational events for your community centers, for your local community. I've spoken to a few of you over the last few weeks that do this already and have got a lot of success in helping these folks. And you don't even need to think about the plans, what you're going to sell, because you are there as a resource. You're helping folks understand the differences between Medicaid, Medicare, dual special needs plans, Medicare plans, and of course that fee for service as well. Just by being a resource, just by helping these folks that are in these different areas and need our help, you are going to automatically have the opportunity to do enrollments. You're going to have the opportunity to help these folks, but help yourself. And of course, if you speak another language, this is so important. In these communities, there are so many eligibles that do not have English as a first language that need our help. So if you speak any other language, please reach out to the community. If you're not sure how to do that, reach out to me or one of my team. We can get you involved. A great place to start is some of these faith-based organizations like churches or synagogues or mosques or other different religious entities here. Please, they can put you in touch with things like food banks. You can have your name, you can have some educational pieces, some things that are based on education to help these seniors understand this. We can get some of these pieces in different languages for you. We can get it translated. And of course, you're there to provide help. And again, talk to your carrier partners, talk to provider groups, look for things that are happening in these counties. Look at what's happening in California. And even with the lookalike plans going away, there's a lot of new plans for those folks that may just have LIS, that don't understand what it is. So go out in your communities and again, put a plan together where you can help these folks that are in need. Marketing resources. We have a ton of marketing resources. We have that one-on-one consultation with not only me and my team as well, but also at our upline with Berwick Insurance Group and Integrity. You've got some unique ideas and templates, and coming later this year, we will have even more templates and more marketing pieces just for AMA agents on our agent portal. We've got lead generation assistance. We also have got things to help you build your brand and really get your name out there. That's what marketing is making sure you're not a secret. Marketing isn't necessarily selling. Marketing is just telling folks and informing folks that you're there to help them. You can advertise, again, using some of those SEP catalogs, T65, dual eligible catalogs, and again, you've got the AEP catalogs as well. Don't forget retention marketing. Make sure the clients you do have, they can refer you, right? As well as retain your existing book of business, non-traditional ideas and steps. And I would really focus on that outreach, that community-based outreach that you can do for those folks that are dual eligible. Sending letters. If you have other lines of business, you can send a simple letter saying, look, I offer a full suite of Medicare services. I'd love to come into your, whatever it may be, workplace or your church or your food bank and really help out and be able to answer questions for those folks that have Medicare and Medicaid as well. And of course, you can see we have many of those pieces in not only Spanish, Chinese, in both Mandarin and Cantonese, Russian as well as Tagalog, and many, many other languages as well. And of course, that AEP catalog is out now. So if you're going to do this in AEP, you can use the AEP catalog, but don't use it before October the 1st. But this is about once you are in and have a contact or somebody you know in one of these local community-based organization, then utilizing the marketing resources and pieces as well. Create your flyer, make it generic, customize it with your information. And again, ask the office manager. I'm visiting doctor's office is today to talk about extra help and Part D program. Have you heard of it? Many of them say probably, I've heard of it, but I don't know how it works. Well, I can actually help folks that have low income and assets. And if they qualify, they can pay from 0 to 130 for generics, and obviously 0 or 385 for brand drugs. And this is even those expensive drugs. So again, some of the questions to ask, particularly in a doctor's office or a pharmacy, do you have some of your patients that actually say, look, they have to cut their pills in half, they can't afford them, or they need to stretch their meds out for an extra month. It just takes me 15 to 20 minutes to help them apply. I can actually help them apply for this extra help program. What a great service that is to offer. And you have not spoken about selling, you have not spoken about enrolling, you are helping these folks. And guess what's going to happen? If you can help them save money on their prescription drugs or understanding about Medicaid or Medi-Cal, they are going to want to use you as a resource. Again, the pharmacist, exactly the same type of conversation as we just went through, utilizing the extra help program. And again, you can assist all of those folks that have both Medi-Cal and Medicaid. Again, if you go out to some of these community places, go out to maybe that food bank or a community center or a senior center and say, look, I focus on some of the folks that are both dual eligible. And of course, that Cal MediConnect plan went away last year. There are a lot of changes. We've got the Medi-Cal, Medicaid redetermination, where if folks don't answer the letters that are being sent to them, they may actually have a change in their eligibility. I'd love to do a little 15-minute seminar on this. And you can utilize this as an option to go out into some of these community-based places as well. And again, this is just talking about those folks turning 65. So use these type of conversations for any type of relationship you're trying to build. Have it in your heart to go out and want to help these folks, because by helping them, you're going to help them understand how the programs work. And we all know that Medicare is complicated. Medicaid and Medi-Cal and those dual eligible is complicated. You imagine if you have English as not your first language, how would you navigate the world of Medi-Cal or Medicaid? How would you navigate Medicare? You wouldn't. So they need our help. And that's why it's important to work with a local licensed agent that can help them. I love this one about Silver Sneakers or some of the gyms. So look into there and just talk to the folks that are going and using that gym. Don't forget, these gyms get paid every time somebody scans into one of these gyms. So it can be an income maker for the gym, but also you are helping these folks understand the programs that they have available to them as well. So, you know, what I love about this is just some of the different things you can do. To do this, you've got to plan ahead. You've got to create your action plan. If you want to do seminars, how are you going to do that? Direct mail. How are you going to get those leads? How are you going to market that as well? And also make sure you have your deadline. Don't forget, this time of year, it's all about certifications as well. Once you're talking about AEP planning, you've got to get those certifications done before you can even do any of these programs as well. Maybe do some retail programs. In August, it's talking about planning any seminars. So if you're going to do some of those educational events as well, and of course, those plan review letters, use the templates that our team at Berwick and Integrity have. Use our templates, send it out for both referrals and retention as well, and attend a lot of the carrier meetings. We've been talking about this on our virtual coffee on a Friday as well. Do those plan reviews and those client reviews as well. And of course, do that before you get to AEP. But this is a year-round opportunity. I'm just talking specifically about the next few months. And then when you hit the end of AEP, when you hit December the 8th, yes, take some time off, because that's after our very, very busy time. But then plan next year. You should be planning Q1 before you get to the holiday season, Christmas, Hanukkah, all of those. You should be planning next year as well. And of course, AEP is all about offering and enrolling clients into Medicare Advantage plans as well. So that's the important time of year. We've gone through a lot today. We've spoken a lot about how Medi-Cal, Medicaid, and also those folks that have Medicare have that together as we call dual eligibles. And then we've spoken about how that works in both our communities, how we can actually go out there and help them understand how to enroll in a Medicare Advantage plan, whether it's a dual special needs plan or a Medicare plan. We spoke about the differences between the Medicare Savings Program and Medicaid and Medi-Cal. And then, of course, we spoke about LIS, how that integrates. We also spoke about the qualifications and the changes that have come this year. This is a topic that's not going away. It's a topic that a lot of us don't really immerse ourselves in. We kind of dip a toe into the water, but it's a program that probably our Medicare eligibles need our help the most. So if you're prepared to put the time, the effort, learn about these programs in detail, you can get huge success, not only for you, but for your eligibles, your clients that you're helping every single day. These are the folks that need our help, and we're here to help. Thank you so much for listening for the last 40 minutes. I hope you found this useful. Thank you.